Well, it's actually a named condition that you can find in medical journals. It's actually called seasonal affective disorder. It's a form of depression because depression is categorised in many different forms, and it's actually only been documented in about the last 15 or 20 years. There are some reasons that suggest it's social, just because the fact that we talk about the weather and therefore people latch onto that and make sure that they are part of the conversation, if you like. But there have been biological bases to support it. So, for example, the hypothalamus is a part of the brain which controls the endocrine system. So basically it controls the hormones, but it also controls what's called your circadian rhythm, which is your body's internal clock. So once our sleep levels are disrupted, then we naturally become a little bit irritable and can sometimes get low mood because of that. Seasonal affective disorder, when it comes to thinking about the weather, is when this is a little bit more enhanced. So it's more than just an everyday grumbling about the weather. It's something that is a sustained pattern of behaviour where mood goes further down and further down until someone actually perhaps might need treatment. It's something that you can't necessarily avoid, because if the neurological or biological imbalance is in the brain, then it's something that we don't always have immediate control over. By all means, you must go and speak to your doctor about any type of depression, whether you feel it's weather-related or anything else that's causing it. But if you do feel that your mood is getting low, by all means, speak to a GP. There are sort of three main sources of treatment, really. If in really severe cases, some people may suggest light therapy, which is usually administered under clinical conditions in the hospital. The most common recourse of treatment is antidepressants, so psychopharmacological medication. So usually Prozac, fluoxetine, any of the types of drugs that would be administered as in other cases of depression. Sometimes people will go for talking treatments as well, such as cognitive behavioural therapy.